Have you ever had numbness or weakness in your leg? Well, the problem may actually be in your back. Here to explain that and how to get treated is Dr. Richard Busch from Busch Chiropractic. Doctor, thanks for joining us.
Thank you very much as always, Tara. Appreciate it.
Okay, so explain this. How is it that if you're going to have pain down here, the actual source could be your back?
Well, your sciatic nerve actually comes out of several different levels, or in between several different bones in your spine.
Okay.
Okay, from your L4, L5 vertebra, or your fourth and fifth lumbar vertebra, that nerve root actually comes out and goes down into your leg. But then also along with that, the first, second, and third sacral nerve roots. They actually exit the spine and then they come together and they become a nerve that's about as big as this pinky, okay?
So it all boils down to nerves.
Exactly, and so that nerve comes right down through here and goes down into the leg. And so in a lot of cases, if we have pressure on that nerve closer to the spine, it can actually cause the pain down into the lower part of the leg and the foot, or even the back of the thigh, or the buttocks.
Okay.
So as far as that's concerned, they can also have numbness and tingling. They may have muscle weakness associated with it as well, or they may have a combination of any of those. They may have, this may be a situation that's causes severe pain, or it may be just a mild, moderate type of a discomfort as well.
Are we talking stinging?
It can be stinging, it can be sharp shooting, burning types of pain.
Okay.
Okay, but then along with that, numbness and tingling as well.
Okay, so how do you treat that?
Well, there are a lot of different things that we could do. First of all, we do actually work with exercise to help patients actually alleviate some of the muscle tightness, and that can sometimes help alleviate some of the discomfort. But more often than not, the problem is actually coming from a degenerative or herniated type of a disc in the lumbar spine. And so we use the DRS protocol to treat that. DRS stands for decompression, reduction, and stabilization. We've talked about this in the past.
Right.
Because we're decompressing a nerve, or we're taking pressure off the nerve, we're reducing the disc bulge and stabilizing the whole thing, so the whole situation, so the problem doesn't return.
And we're looking at video right now. Is this that process that's going on?
This is actually a patient on the table, going through treatment on the table.
Okay.
And as far as the table is concerned, they're very comfortable. Okay.
Okay.
And most of our patients actually fall asleep during treatment. And so we're actually applying a force along the axis of the spine so we can actually pull that disc level apart, which creates a pressure gradient between the inside and the outside of the disc, and that allows us to bring in oxygen, water, nutrients, everything the disc needs to heal.
So there's no discomfort with this procedure?
In most cases, it's very comfortable. Most of our patients actually fall asleep during treatment.
Okay.
Some cases, they may have a little bit of soreness afterwards, kind of like they went to the gym for the first time. But it's a very comfortable treatment, and the neat thing about it is, I guess the amazing thing about it is, that as far as treatment is concerned, we can help a lot of patients that we only thought were going to be surgical candidates
Right.
before.
And that's a great thing.
It's a great thing to avoid surgery.
We could talk more, but we're running out of time.
Thank you so much. It's a pleasure to meet you, see you as always.
Dr. Busch, thank you. You can learn more about the Busch Chiropractic Center by calling the number that you see on your screen or heading to buschchiropractic.com. And you can watch the Medical Minute every Monday during our noon newscast. Pat, back to you.